I've been waking up slow with the weight in my chest, like the sun forgot how to shine in the west. And I smile when they ask, say I'm doing just fine, but there's thunder rolling quiet in the back of my mind. Some days are light, and some days I fade, and some days I break for my own damn sake. Well, the thing is, I'm trying, even when the voice in my head keeps lying. It's a war just to get out of bed, but I breathe in deep and I face it instead. No, I'm not alright, but I'm fighting to be. Well, the thing is, I'm still me. I got friends who don't call, and I don't blame them. Hard to hold space when your world's gone vague. And I wish I could tell you what's missing inside, but it's foggy in here, even with open eyes. I wear my silence like armor, I know, but there's hope in the cracks where the light starts to show. Well, the thing is, I'm healing, even when I don't trust what I'm feeling. Every scar is a line in my song, every stumble's a sign I've been walking this long. And I don't have a map, but I've got my feet. Well, the thing is, I'm still me. I won't lie and say it's easy, but I won't hide the storm inside. If you're walking through the darkness, take my hand, we'll walk side by side. Well, the thing is, we're learning, and the fire in our hearts keeps burning. Even when the night feels too long, the strength in the fact we go on. So if you're not okay, let this song set you free. 'Cause the thing is, you're still you, and that's still enough for me.
You're still you, and that's still enough for me. Welcome in, everybody.
Hola.
What's up, K-Mode?
Hey. How y'all doing tonight? Hope everybody's having a good night or day, afternoon, wherever you're at in the world right now.
So, tonight's live is about Tourette syndrome. You know, and the reason why I bring this up, well, somebody in chat mentioned it, or somebody mentioned it, and it had been on the back of my mind for a long time, because I actually used to know somebody that had Tourette's, and people used to make fun of them because they would just blurt out words or noises, you know, and they couldn't control it. You know, over time, they learned how to control it, sort of.
It's really hard for them to control it. We had a personal friend in our life that was a family friend who had a severe form of, he had both the physical tics and the verbal tics at the same time. And they could be very painful, like some people actually hit themselves.
Yep.
And, you know, so that's why I think this is a good topic, because you never know who out there may have Tourette syndrome or might know someone who has it and might educate them more on it.
Like, I knew a kid that had to wear a helmet because he would hit his head a lot. He had no control. Like, if he was sitting near a wall, he'd smack his head off the wall. It would just be an urge. Like, he would punch himself in the head. He'd headbutt things, you know, and people would make fun of him. I didn't make fun of him because I knew something was wrong, and, you know, he knew something was wrong, and it was just a battle. So now we're going to go to the article. It's in the description below, through the Cleveland Clinic. And I'm going to start reading some of it, and then Charlie will read some of it. So, Tourette syndrome. Tourette syndrome is a disorder that causes uncontrollable movements and vocal sounds, called tics. It often shows up in early childhood and improves in adulthood. Tics can be mild or severe. Medication and therapy can help reduce tics. What is Tourette syndrome? TS is a neurological disorder that affects your brain and nerves. It causes you to make sudden movements and sounds called tics. Tics are involuntary, so you can't control or prevent them. Motor tics involve body movements, eye blinking, shoulder shrugging. Vocal tics involve your voice, like sniffing or throat clearing. Motor tics tend to develop before vocal tics. Tourette syndrome, or Tourette's, usually start in early childhood. Most of the time, tics become milder and occur less frequently in late adolescence and adulthood. Tourette syndrome is the most severe type of tic disorder. Tourette syndrome affects 1 out of every 160 children, which means that approximately 300 children in the United States have the condition. Symptoms and causes. Symptoms of Tourette syndrome. The most common Tourette syndrome symptom are motor and or vocal tics. Usually start between the ages of 5 and 7 and peak at around age 12. Tics are either simple or complex. Simple tics are quick, repeated movements that only involve a few muscle groups. Shoulder shrugging, throat clearing are simple vocal tics. Complex tics involve many movements and muscle groups. Jumping or repeating certain words or phrases are complex vocal tics. Tourette syndrome causes. Researchers don't know the exact cause of Tourette syndrome, but the condition tends to run in families, so they believe genes may play a role. Issues with how your brain breaks down metabolic neurotransmitters may also contribute to Tourette syndrome. Your neurotransmitters like dopamine are chemicals in your brain that regulate behavior and movement. Risk factors. Risk factors for Tourette syndrome may include sex. Males are 3 to 4 times more likely to develop Tourette syndrome. Biological family history. Parents may pass down Tourette syndrome to children through genes inherited. Prenatal health. Children born to people who smoke or had health complications during pregnancy may be at a higher risk for Tourette syndrome. Low birth weight may also increase the chances for Tourette syndrome. Do Tourette's occur with our health conditions? Most people with Tourette's have other health conditions. This is why one of the reasons why I want to talk about it. They are usually mental health or behavioral health disorders, including anxiety, ADHD, autism spectrum disorder, depression, learning disabilities, OCD, ODD. And I will tell you, somebody that has oppositional defiant disorder, they're very hard to handle. You may go.
Diagnosis and tests. How doctors diagnose Tourette syndrome. To diagnose Tourette syndrome, a provider checks when the tics started. They should begin before age 18. Your child must have had both motor and vocal tics for over a year. There isn't a blood test or imaging exam that can detect Tourette syndrome. Instead, your child's provider will carefully review their medical history and symptoms. Their provider may also do tests to rule out other conditions that could be causing tics. Management and treatment. Tourette's syndrome, mild tics that don't affect your child everyday activities might not need treatment, but severe tics can make it hard to function at work, school, or in social situations. Some tics can even lead to self injury. In these cases, Tourette's syndrome treatment, including medication or behavioral therapy, may help. Tourette's syndrome medications. For mild tics, your child's healthcare provider may recommend medications that typically treat high blood pressure. These medications include clonidine and guanfacine. For, for more severe tics, your child's provider may recommend neuroleptics, antipsychotic medications. Neuroleptics are drugs that limit the activity of dopamine in your brain. Dopamine is a chemical that can increase tics. Other medications can help manage conditions that occur with Tourette's, like ADHD or OCD. Tourette's syndrome.
Charlie,
Okay.
the medication you were trying to pronounce is called clonidine.
Okay, thank you.
You're welcome.
Because that's one of the harder things.
It happens to me and you. Trust me. You hear it when I'm reading.
Tourette's syndrome therapy. The tics associated with Tourette's are involuntary, so they aren't something you or your child can control. But new therapies help people manage tics and reduce their negative effects. Comprehensive behavioral intervention for tics, or CBIT, helps people by recognizing tics. Sometimes people feel a sensation right before a tic occurs, called a premonitory urge. By recognizing this urge, they may be able to mask or suppress the tic. Respond to tics. Doing a new and different action when a tic occurs is a competing response, a voluntary action. Shutting your eyes limits the involuntary action of blinking. Reduce tics. Excitement or anxiety tends to make tics worse. Staying calm, avoid stressful situations may reduce the frequency of tics. When should I contact my healthcare provider about Tourette's syndrome? Contact a healthcare provider right away if someone with Tourette's syndrome becomes violent, injures themselves, or talks about suicide. You can call or text the Suicide and Crisis Lifeline at 988. Outlook and prognosis. What is the outlook for someone living with Tourette's syndrome? There's no cure for Tourette's syndrome. The condition usually improves by early adulthood. Tics may still occur, but most adults don't need to continue medication or therapy. What is the life expectancy of someone with Tourette's syndrome? People with Tourette's syndrome have a typical life expectancy. Tourette's syndrome isn't a progressive condition. It doesn't get worse over time. In many cases, the condition is mild and the tics go away on their own. A note from the Cleveland Clinic. Tics among children aren't uncommon, and they're usually harmless. But if you notice your child's tics becoming more severe or frequent, it's possible they may have Tourette's syndrome. If you can, take a video of your child performing their tic so you can show it to their healthcare provider. Your child's provider can determine if the Tourette's is affecting your child and recommend appropriate treatment. It is important to remember that your child can't control their tics. Their tics make them unique. Make your friends and loved ones and your child's teachers aware of your child's tics so they understand the condition, and work with your child's provider to get them the best possible treatment to manage their tics.
So on that, I want to jump over to the article. These are examples of tics, verbal and nonverbal. So in the Mayo Clinic article, if you scroll down, it comes to common motor tics seen in Tourette syndrome. These are simple tics: eye blinking, head jerking, shoulder shrugging, eye darting, nose twitching, mouth movements. Complex tics: touching or smelling objects, repeating observed movements, stepping in a certain pattern, obscene gestures, bending or twisting, hopping. Those are the common motor tics seen in Tourette syndrome. Now, if we're going to get to the vocals, okay, so the simple ones when it comes to vocal tics: grunting, coughing, throat clearing, and barking. Okay. The complex tics is when someone repeats own words or phrases, or they repeat what you say over and over again, or they use vulgar, obscene, or swear words. You know,
That's the way that my family friend, that was one of his things, is he would use vulgar language, and it would be a phrase, and it was really nasty. I dare not repeat it. You know what I'm saying?
yeah.
And that was one of his, and then his other was a very violent, to the point like he would beat himself. He had a bad habit of busting out people's windshields. My dad looked at him and goes, I know you can't control it, but if you bust out my windshield, it's gonna be your butt. So I suggest you not to do that. Believe it or not, he never busted out our windshield. But he had violent ticks, really violent one. And I'm gonna say this for seeing somebody, and maybe you as we're talking about, like someone who has that, it's hard for them to control it. And when they try, it actually can be very painful to hold back the ticks.
No, it can be. It can be. But eventually the pain gets better. The more they do it and the more they do it, the body gets used to the pain. Like if you ever watched America's Got Talent, and there's this female, she has Tourette's. But when she sings, the Tourette's go away. And that's what's amazing, because there's things you learn your strength, and you can take that strength and be like, okay, if singing gets rid of my tics, I'm going to sing more often. But that's not the way to communicate, Evil CJ, how you doing?
What up, Matthew Acilius Food?
So
how did the pot roast come out? I'm just wanting to know.
CJ, what have you been up to, man? I tried to get over there, but I got too many friends who game, so I'm all over the place. Hope you're doing well. So, been a while. Now I'm going to drop the link and open up the panel. And if you have anybody or know anybody that has Tourette syndrome, okay, bro, Evo, CJ, I'm always open. I don't mind coming back over, hopping up on your channel, doing whatever, you name it. We can discuss it. I enjoy your company, so we can talk whatever.
I know how it is to get busy. Trust and best believe that adulthood hits us hard as all get out sometimes.
TJ,
that's cool. That's really cool, TJ. A film about a man called John Davidson, I swear, is a 2025 Scottish biographical drama film. John was awarded the MBE from the Queen for his work in the community with others who have Tourette's. That is really cool.
Yeah, it is.
I'm about to watch that movie. I'm about to figure out where I could watch it, because I'm going to say this as someone who I saw like this, one of the more severe cases of Tourette syndrome. And I've saw some of the, less severe, where it's just like eye blinking, rapid movement or something like that. And it doesn't seem as bad. It's still bad. People don't understand. But I've seen the more violent, if that makes sense, the more severe case. And he had it into adulthood. It doesn't always go away. Now, the milder forms may or may not, but the severe forms, no, his stayed the same, right? It didn't get any worse or any better. It just, it was always there. And he had both the verbal component and the motor. and he would have bruises all over his chest, his face. There were many times that people would try to help him by kind of like, and it like he had other things along with his Tourette syndrome. Because it absolutely, I believe he may have had CP or cerebral palsy along with it. Because his arm would draw up and he couldn't like straighten it out, if that makes sense. And he would hit himself real hard, like real bad. I do believe he had other things along with it. Some kind of muscle condition, you know. That's why I said CP. See, a lot of people also don't know what CP really is. And it goes from mild to severity also. A mild case of it could just look like somebody had a stroke, right? That's what a mild case of cerebral palsy looks like. Severe case, a lot different, you know.
So Bob Robinson said, "Hey Eddie, great topic. I have mild Tourette's. It hasn't been easy, but I deal with it just fine. I'll be listening as I cook dinner. Now I'll probably get trolled. I don't care."
Well, they don't know what it was like for you growing up or having to deal with that, and so it's none of. I'll tell you this: I'd cuss them out for you. I'm just saying. I'll jump off the porch. But like you know, I would love to hear from someone like yourself. I know you're cooking right now. I wish you could hit the panel link. Because I would like to hear what it was like with mild versions, right? I've seen the severe from someone else, but I've never truly been around the milder version as much, if that makes sense. I've seen it a little here and there, but not like, is yours more verbal or physical or both? Because they call it motor technically, motor function and vocal.
And Bart, dude, I want to tell you something. You know, we're in similar communities together. We get around, and if anybody trolls you or says anything inappropriate to you about what you just said on here, trust me, me and Charlie sending love will jump off the porch.
He'll call me and tell me, get over here and hand me a link, and then I'll come over there and I'll just go cry. And you don't want me to go cry, see? He knows I'm crazy. The other person may not. Mr. Eddie knows I'm crazy. He's seen me jump off the porch. That is so cool, TJ. In 2023, John is invited by researchers at Nottingham University to test a treatment device. 1. 2, he finds that it calms his tics to the point that he remains quiet throughout the entirety of the visit to the Universal Library. That's actually really cool. Well, I'm your young daughter who will punch a person in the face for you because you're old enough to be my daddy. So, yeah. I'm your extra daughter, and I will punch somebody in the face for you.
Rosalind.
What up, Vibrant? Tata. Hey, everybody coming in. Miss Rosalind.
Man. Ma. All right. I'm going to say it. My Puerto Rican mommy.
My mamacita. Hi, mommy.
She's probably over here. What the fuck?
She gonna come up here and get both of us. What you talking about? I'll be like, I don't know what you're talking about. I ain't do it. Yeah, if anybody wants to hit the link to talk about Trace, or you just want to, talk a little bit, that's also fine. Tourette's though, I would love to learn more about it from a person who actually experiences it, because I've only seen it secondhand. Right? I've only seen it from oh, look, I got one of the gifted. Yay. Look at me. Because I'm a bro bee right now. Okay.
So Bart said, I have slight verbal and physical. Thankfully, I'm physically fit. He said, "I appreciate your comments and support."
Yeah, for every person, it also I've noticed that it's different. Like his was he had a phrase, and it was always the same phrase. It was never really there was two. I know for a fact that that's what he said most of the time. And when he said those, they were always the same phrase for him. Like they didn't just switch up and become cutesy. That's one thing I want to talk about too when we're talking about Tourette syndrome. I know a lot of people think it's cute and they try to pretend they have it and they magically get their ticks on camera. It's a huge thing that came down the pipeline through TikTok, toxic TikTok. Um, that people thought it was cute to fake, right? And I'm like, you don't understand what these people go through that's not cute to them. It's just like me with my ADHD. If I could give it away and not have it, I would. And I'm pretty sure they feel the exact same way. You know what I'm saying? Like if you have bipolar or anything mental health related, you wish you could give it away. You know what I'm saying? You don't want it. You know what I'm saying? It's a hindrance in some ways. And then other times you're like, okay, I can deal with it. Right. But to pretend you have something that you don't and try to make it cute when most people will tell you with Tourette syndrome, it's not cute and it's not fun and it's very embarrassing. Especially when you're like in a situation where let's say you're in a courtroom or in a public speaking engagement and you're trying to be quiet, but your tick acts up. You know what I'm saying? Like it could be very embarrassing if you're not trying to draw attention to yourself. And I think it's very wrong. And I am so sorry for those with Tourette syndrome who've had people try to pretend to have your disease and when they really don't. Because I know that's got to be like really hurtful to your heart because you're like, now people don't take people who really have it seriously, right? Because of that stuff. And it's to me very disheartening to act like it's a cute thing, it's a fun thing. What up, Vibrant? That's like with like people with schizophrenia and stuff and different things. And believe it or not, some like Tourette's is one of the ones that is not caused by medications. It is caused by genes, like we said, by a parent who had it or things like that. Genetics play a huge role in Tourette syndrome. But there are other mental conditions, as we're speaking on different ones, that can be caused by medications, right? And can onset late. To ask, has anybody known anybody that they believe they say they developed it in their 30s? Because I don't think, unless in case there's brain damage that happens that causes it. Because usually then that would be, it's not Tourette's, it's Parkinson's, right? Yeah.
So Bart Robinson said, anxiety and worry is also an issue, but thankfully I'm retired and that's a lot better now. Rosalind said vocal. They also have epilepsy.
Yeah, she has a friend from camp who has active Tourette's. They're more vocal and they have epilepsy. A lot of people do have multiple disorders when they have Tourette's. Like sometimes it can be cerebral palsy, sometimes it can be epilepsy, because I truly, it's like we were talking about the neurotransmitters, right? It's the brain firing off wrong, if you think about it, right? Those little things in our brain that goes pew 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 and sends all the electrical signals to do what they're supposed to do. They're not doing what they're supposed to do correctly. They're going, woo! Jesus, take the wheel. Let me release the wheel and just let you.
He said, Bart also said kids were cruel when I was younger, for sure.
And that's another thing that, y'all literally have to go through is the cruelty of it all and people not understanding Tourette's or having experience with it. And nobody will understand but you yourselves what that feels like. and how it feels on the inside. Thank goodness they got clean, Miss Rosaline. Thank goodness. A lot of people try to self-medicate. What up, Tom Goblin? How you doing? Tomb Goblin. Why did I just totally just discount the B? I guess I thought it was silent, y'all.
So, Tomb Goblin is actually a friend of mine, a really good friend of mine. Known him for years. So, yeah, I gave you a wrench there, buddy. So, I've known him for years. For years. We go back some years. At least 10. At least 10, bro. If not longer. I think it's more than 10.
Hey, Auntie Sherry.
Because Illitant introduced us. Yeah.
Yeah, in all my research, Mr. Bart, I have found that yes, a person is definitely born with it, and it's not something that's how you catch a liar who doesn't know much or haven't really done their research and think it'll be cute to pretend to have Tourette's. They'll try to claim that they, however, got it later in life, which is not a thing. Usually they're born with it, but like people don't get diagnosed until they're, around a certain age where it's more visible when they're in school and stuff, especially like if it's more severe. If it's a mild form, sometimes they can be up to 13 or 14, maybe 15 before they get diagnosed. Depends on the severity, I suppose, of the Tourette's, of when the actual diagnosis takes place. But it's usually caught because it's like rapid eye movement, something that, you look at a person, you can visibly see a little bit, at least in that. And then when the verbal component does come out, it's even more, hey, this leans more towards Tourette syndrome. You know what I'm saying? But that's why they usually say, I think between the ages of 12 to 14 is when most people, I says, and then some people's tics actually go away as they get older, but some don't, or it sometimes gets easier to manage or deal with. I love that. Tom Goblin said, I heard about your legend years before meeting you.
Yeah. Yep.
Now I'm thinking about the song from the one about Princess Diana. Your legend fell down long before the legend ever did. I don't know why, but it is, magic.
So
you don't
Tomb Goblin is an amazing musician. I will tell you that. An amazing musician. That's what we went over, TJ. It's just that we were talking about there's a lot of people on TikTok that act like they have Tourette's and they don't, for clicks and views to make money off of. There's a lot of people on TikTok that do it to make money off of other people's struggles.
And it's super sad to me. Yeah, that's how you catch a liar, though. If someone tries to claim that, yeah, Candle in the Wind. Thank you, TJ. That was the song that was running through my head. But yeah, most of the ones who pretend to have the disorder and don't really have it, they'll try to claim that they got it later in life, and that's that's not the way Tourette syndrome works. Now it can be a different thing, but it's not going to be exactly like Tourette's, right? You can have rapid movement. It could be something else, right? It's called neurological or something like that. And it's a disease to where the brain is causing those issues, but it's not Tourette syndrome. there's a difference, and you don't have the vocal tics and the you know, a lot of the tics that go with Tourette syndrome. It looks similar, but it's not the same.
So
That's, you know, how
stuttering, also known as stammering, is a speech disorder characterized by disruption in the normal flow of speech, including sound, syllable, or word repetitions, sound prolongation, or silent pauses or blocks. You know, so that's totally different than Tourette's.
Yeah, stammering and stuttering is neuro-related, but not Tourette's. You're right about that because, like, that's why there's some people who are pretending to have it. You can absolutely catch some of their things, because they don't really have Tourette's. They only know what some people who they've seen have it do, so they'll repeat that or repeat something similar to that. Or try to, but you can absolutely catch them in it. There was this one girl, she got real famous on TikTok, and she would do these little cute things, and they actually caught her because people with Tourette's, real people with Tourette's, asked her some real questions, and she was stammering over saying it, and they physically caught her lying about having Tourette's syndrome. And I'm like, why would you do that to that community? Why would you use them? You know what I'm saying? And play on their heartstrings. And it's sad to me because, you know, it happens. Yeah, you're right, Vapor. It doesn't just on TikTok. It's on YouTube and Facebook and possibly Kick now. It's sad because they don't understand internally what someone with Tourette's actually goes through and how they feel and what they, you know, have been through their lifetime from being a kid, a small child, dealing with this and not understanding what's wrong. You got to think when you're very little, even if an adult tries to explain to you, you don't fully understand until you're older, right? And you just know you're different, and you know that people are making fun of you or giving you dirty looks, and there's nothing you can do about it because it's something you can't control fully, right? And you're learning, but it's hard when you're a child. You know what I'm saying? A small child.
It is.
To understand. And that's why it really breaks my heart, because I know people who have it and they would give their left arm and leg not to have it. And it's not a cutesy thing. It's not fun for them, you know? They shouldn't be made fun of for having it in the first place.
So spike this. So he said mild Tourette's, and simple voices, tics, SVT, is the most fascinating to me.
Yeah, and I've never known someone who their Tourette's actually went away. But we read that in the article, right? We read that in the article that sometimes for some people it does, right? I've never known anybody who it actually goes away. I've heard that for some people with a mild version, it gets easier to deal with the older they get. The more severe form, obviously, it's just hell on wheels, you know. But I've heard for the person who has it more mildly that it becomes a little bit easier to cope with, you know, when they get older. But I've never heard of it going away, even though it says that in the article. I'd love to meet someone who actually that happened, where they may have had it as a child, but they grew out of it. And I would be like, you know, very rare, probably, in my opinion. I don't know if any of y'all have experienced that or known anybody who had it as a child, but they grew out of it. I know that dyslexia and other things, you know, it can be, Miss Sherry. It can be constant. It isn't all the time, but it can be an everyday thing with a severe form of Tourette's. The person that I physically knew in real life who had it, one of their tics only happened every once in a while, or like when they got in a stressful situation or something like that, right? It was their vocal tic, but their physical tic was almost every single day. It was always a movement. Now, not all the time did they beat themselves up. That was like an every other day thing. But it never comes at the same interval. Now that you're right about, Miss Sherry, it never comes at the same interval. It happens at the weirdest, strangest moments. You know what I'm saying? But for him, it was almost daily because he had social anxiety and he was always in public. So you can imagine, you know, if he was outdoors, he was around people and a lot of people were talking, it would make his anxiety go up, which made the tics worse. But he loved being around people. You know what I'm saying? At the same time. So he just dealt with it, I suppose. But he had a very severe form. Like it was bad. And I felt so bad for him when he would he's broke his glasses. I've seen him with bruises all over his face, busted lip. You know what I'm saying? Things. And I know that had to hurt. And he did it to himself. He couldn't stop himself, you know? I know that had to hurt. And I always felt so bad for him. And people would give him dirty looks. You know what I mean? But I would love to learn more from someone who has a mild form because I've only seen it in the severe.
Yeah, me too.
Maybe the reason why we never paid attention to the mild form is because it's so mild that you have to really pay attention, right?
Yep.
I did know somebody who had rapid eye blinking, but I wasn't sure if it was from Tourette's. Because rapid eye blinking can be Tourette's, but it can also be other neurological disorders, too. So it can also be even an eye disorder or part of somebody with ADHD when they're trying to stay still. Instead of doing the leg thing, they'll do rapid eye blinking. You know what I mean? So it doesn't necessarily, it's usually a combination of things that lets you know it's Tourette's.
So, while we're live, last night I was in the hospital.
What happened?
Well, I have shoulder pain.
Oh, right? Your shoulder, okay.
And every time the doctor pressed on it, it popped.
Ooh.
Every time when I went in to get the X-ray done, and the X-ray tech was pushing my shoulder into the area where he needed to get the picture, it popped. And when it popped, he's like, "Oh my God, I'm sorry." I'm like, it didn't hurt. So afterwards, the emergency room doctor said, you need an MRI. It could be a rotator cuff. And if it's your rotator cuff, they might suggest injections or shoulder replacement. Man, if it ain't one thing, it's another. You know?
It always is, ain't it?
Yeah. I meant to hire a nurse 24/7 if I have to have my shoulder replaced.
Child, we falling apart, y'all. We falling apart. Ain't that crazy?
I have to wait 6 months for my right arm because I know I'm going to have surgery again. They're going to have to cut it open, replace the plate in my right arm. Yeah, I know. And it is what it is.
Yeah, I'm going to say this. You can't trust a fart no more. You can't trust a sneeze. You got to be careful getting up out of bed. You've been pulled your whole back out. As we get older, we got to be careful because you can't even trust a sneeze no more. But
the shitty thing is, right?
Yeah.
Is I was avoiding trying to raise money to help pay somebody to remodel my bathroom because it needs to be done. I was going to do it myself. But with the shoulder problem and the right arm, forearm problem, I can't do nothing. I can't, with my right arm, I can't lift anything more than 8 pounds. Okay? So I can't tear up the tub. I can't pull out the toilet, and I can't depend on my 78-year-old mother to help me. You know, even though she's strong as an ox, believe it or not, she is strong as an ox. Okay, you know, I can't depend on her. You know, she's not a carpenter. It's just.
I wish I was closer.
When I talk about, like, I have friends that will help, but I got to pay them. You know what I'm saying? And money don't grow on trees. So it's like it's one thing after another, and sometimes when you struggle with depression and mental health issues, and you are where I'm at mentally, sometimes you think throwing in the towel is a lot easier, you know. And sometimes I'm at that point where it feels like it, but then I look at it, you know, what am I sending a message to if I did it, and people around me found out that I did it? Then it basically, I was a hypocrite. You know, you fight through it. You're a warrior. You know, you overcome all these obstacles and you keep going.
Remember, this too shall pass. That's a mantra you should tell yourself, right? I'm going to tell you, when I've been down at my lowest and my physical pain was at its highest, it's like you're in a hole. It's the best way I could explain it to somebody. And you're trying to desperately claw out of that hole, but it seems the more you try to claw out, you keep going deeper instead of going up, right?
Yeah.
And dirt keeps getting thrown in every few minutes. You know what I'm saying? And you're steadily trying to get up that side of that wall, but it just keeps coming down on you. And you think you get to the top, you're right there. You can see the light, and then something pushes you right back down every time, right? And I've been there. I know, you know, from personal experience. You know, not only could you crowdfund, but I also will say, it depending on how bad the situation is, when it needs its thing, you could also wait a few months and save up, if that makes sense. If that's possible. You know, secondary thought processes, right? Sometimes we don't see our way out of something, right?
Yep.
Maybe doing something a little at a time, and then only hiring people to bring in the heavy stuff, right? Like you can't pick up on the toilet, you can't pick up on the bathtub part, right? And see if somebody would do a thing where they work with you about payment plans.
Yeah.
That's also a possibility. You know, you never know when an angel's gonna come through. I will tell you this: every time I thought I was at my lowest and I'd pray, for some reason, every time I thought I couldn't make it through, and it was this was just gonna be the end for me, you know, something always worked.
Jennifer Hiney Hall.
I love her name just because I want to say Hiney Hall. Like Tally, I want to say it like Tally.
So I go live Monday, Wednesday, and Fridays, and I have a co-host, Charlie Sending Love. It's good seeing you again, Jennifer. I knew you'd come back around. It's been a while. I hope you're doing well. So, but that's good to hear, Sherry.
Yeah, I heard that rotator cuff surgery ain't no joke. I heard it hurts. Yeah, so I'm glad he's doing better because, you know, some surgeries for certain people, they'll work the first time, and some people have to have resurgeries. And it's good when you see a person one and done type situation versus I have seen multiple on some people. It just depends on how you heal. It depends on how things go. You know what I mean? Sometimes you can have that surgery and then years don't have to have it, and then you end up having to have a resurgery, right? I like I've been working my butt off for all these years trying to make sure my son never has to have a resurgery because he has cerebral palsy, mild, and he had it on his legs. His surgery was on his legs, and so yeah, he had that, and I'm trying to keep him from having to have a resurgery. He's doing good so far, so yay.
Wow.
You working hard for the money. Jenny's working hard for the money. Jennifer works hard for the money, so they better treat her right. Okay, sorry, had a moment.
So I had something called PRP injections in my rotator tear. I avoided surgery. It's called platelet-rich plasma therapy. Check it out. I will have to. I will have to. PRP. Okay.
Yeah, because you never know. It might actually work. You know, and give you back your strength and stuff. And I know that for men, that's a lot harder when y'all go through those kind of injuries, because y'all are supposed to be the strong men. You know what I'm saying? And because when my dad has degenerative disc disease, right, and he worked his whole life. He did carpentry, he did oil rig, he did all kind of things like that. And when he got to where he was actually in a wheelchair for a little while, and he walked his way back out of one, he felt like less of a man. And I had to tell him, you're not. You're still that same strong, man that I've looked up to my entire life. Just because you're having an issue right now, you get what I'm saying, does not mean that you're not that same strong man. And so that's what I try. Another thing about when we talk about men's mental health and stuff is that y'all sometimes don't share when it's affecting you as much, because it's seen as a weakness. And to me, it's not a weakness. To be truthful and to be honest and be able to share your feelings and be able to reach out, get help, and do those things for yourself, and not just for yourself, but those people around you. Your children, your family, your mother, your significant other, if you have one, it's good for yourself. Self-care is one of the best things. How can you care for anybody else if you can't care for yourself first? Because if you're down, who's going to take care of them? Right? So you got to take care of you first. And then it's like, they say the oxygen mask theory about putting your oxygen mask on first so you can help others.
Yep. I totally agree.
Yeah, positive reinforcement is an amazing thing, Miss Jennifer. I'll tell you that. Positive reinforcement for everyone, and changing your mindset about certain things. Like, I used to be bad on myself because I couldn't physically do the things that I did when I was younger, right? I have degenerative disc disease, and I got mine from a wreck when I was 15 years old. So you can imagine being in your 20s and having the back of an 80-year-old, someone who worked hard their entire life, right? Which is more understandable, correct? So it hurts when you're young and you're supposed to be this strong person and you can't do the physical things you used to do, right? And I had to change my mindset about that. I had to change my mindset because it was just hurting me to do that to myself, to beat myself up like that. I had to realize my new normal is not the same as someone else's, and I had to be okay with my normal. If that makes sense. Like Mr. Eddie, with this situation right now, for right now, until you get that surgery, this is your normal, right?
Yep.
And you have to be okay with that normal for right now. You know that in the future, when you have your surgery, after you heal and all that, and do your physical therapy and stuff, you'll get better. But at this moment, until that situation gets, fixed and whatnot, your new normal for this moment. Yeah, I've been thinking about talking to my doctor about fibromyalgia because I've had a few things that have happened that kind of relate to it. But I got to talk to my doctor about it. Okay, I don't know if you've ever had this, but literally I've had it happen 2 times so far, just twice. Someone just touching me is painful sometimes. Just like you just reaching out, not hard, not grabbing, just putting your hand on somebody's shoulders, like hurt.
Yep.
And then my hair hurt, which was weird. I was like, wait a minute, how does your hair hurt? I'm like, I'm about ready to shave all my hair off. But I have long hair. I do have long hair, so I don't know. It's just the follicles hurt. I was like, I didn't know you could have hair pain. I didn't know that was a thing. But yeah. My state does allow opioids, but you have to take a drug test every 3 months, and you have to have a MRI proof that you actually have an injury for that medication. Like, you can't just get that medication because you stubbed your toe. You know what I'm saying? Like, you have to have an actual condition that can be proven medically, and it has to be something really, really, really severe. And you have to take a drug test every 3 months by our state. And if you get caught with anything other than your medication in your system, they will cut you off. And you also can't take certain other medications while on it too.
Yep.
I know because I go to my regular doctor and I'm on it, but I'm not in pain management. But I take my drug test every 3 months and it comes out clean, except for what I'm supposed to not be clean for. I'm not sure. I need to talk to my doctor about that, Miss Sherry. I've had a few instances that keep popping up of just like this weird stuff happening. And I'm like, what is that? I've never had that before. Oh, cool.
So,
like they have a soap? That's pretty cool.
So my shoulder's starting to hurt.
Oh, you need to go chillax and lay down, and you want to go ahead and finish out the stream and go get you some rest.
I'm gonna relax.
All right. Well,
so not Thursday, Friday. I think a good topic would be dating with mental health.
Y'all ready for the dating with the mental health Friday? And same time, same place.
Dating with mental health. Yes, bring it up with your doctor, Charlie.
Oh, I am. I've been getting them to, every time something happens, chart it. Because the best way to, with those kind of situations, if there's like not a physical proof, sometimes the best way to do it is to chart it, and you keep charting and charting and charting until they see a pattern, right?
Well, they'll do a brain MRI.
I've had an MRI on one because they thought I possibly could have had MS. I went to a neurologist. I did a nerve conductive study, but they can't prove it's not my small nerves. I had problems with complete facial numbness and tongue numbness, and just being completely numb for no reason. I don't know if you've ever had tongue numbness, but try to speak when your tongue is numb. Oh my God, it's so hard. And it's just like the weirdest freaking feeling when your whole face is numb. Somebody could punch you and you won't feel it. Just saying. But yeah, get you some ice and heating pad, Mr. Eddie. And see the thing is, see what had happened was, in retrospect, we love every single one of y'all. And Mr. Eddie needs to go lay his butt down, and I'm gonna let him have the last words. And I love y'all. Charlie is out.
And while the thing is out, you guys have a good day. I'll see you Friday. Same time, same place, 5:30 p.m. Eastern Standard Time. If you want to, buy me a coffee, all my links are in the description below. If you want merchandise, I have a website in the description below, WTTIMHH. WTTI stands for, well, the thing is mentalhealthhangout.com. You can check out my merch store below in that website. You learn a little about me in that website also. All my links are in the description below. The articles we went over on this live stream is also in the description below. So, with that being said, I thank you guys for being here. And I will see you guys later on, Friday, 5:30 p.m. Eastern Standard Time. Well, the thing is out, my friends.